Welcome to the Smith+Nephew digital education module on the I of T.I.M.E, focusing on infection and/or inflammation, which forms part of a series of modules you can access to develop your knowledge and understanding around wound care. Today, we will be discussing infection, the I of T.I.M.E. By the end of the module, you will be able to understand the factors that influence infection and recognize the levels of contamination and infection. The T.I.M.E Clinical Decision Support Tool section for infection or inflammation addresses the importance of assessment, interventions and goal setting. Let's look firstly at identifying infection. As mentioned in previous modules, infection can be difficult to recognize in chronic wounds. Multiple factors influence wound infection. The ability of bacteria to impair healing. These include the size and shape of the wound, the location on the body, how long they have had the wound, any foreign materials on the wound, local oxygen levels, and the patient's level of immunocompetence. Past evidence has suggested that 10 to the power of 5 colony-forming units per gram or milliliter of tissue biopsied was identified as an infection in burn wounds and has been associated with skin graft failure. However, newer evidence reports healing in some chronic wounds with 10 to the power of 5 colony-forming units, and any level of beta hemolytic streptococcus or certain combinations of bacteria at fewer than 10 to the power of 5 can impede wound progress. Therefore, in addition to bacterial quantity and their virulence, an important factor affecting wound infection may be the ability of the host's immune response to resist the bacterial invasion and damage. Identifying wound infection begins with clinical observations. However, signs and symptoms of an infection in a chronic wound can be subtle and are often overlooked. Let's take a look at the signs of infection. As you see in an infected acute wound, such as a surgical incision, the classical signs are usually present. You can see here these are very familiar signs and symptoms. However, with a chronic wound infection, the less familiar secondary signs of infection are more common than the classical signs. A wound that simply does not progress as expected may be infected. Also, a healing full thickness wound should also include strawberry jam red granulation tissue. Infection may be present if there is an absence of granulation or if the granulation itself is friable, i.e. it bleeds very easily. It is pale or is otherwise discoloured. Malodor, increased serous drainage, increased pain at the wound site or wound breakdown are all signs of an infection in the chronic wound. There are various levels of damage caused by these microbes. The contamination infection continuum can help us better understand the effect of microbes on the host. But first, let's talk about optimizing the host's ability to respond. Every patient with a wound exists somewhere on this contamination infection continuum. Microbes are present in all wounds and, at low levels, actually help to stimulate the inflammatory response necessary for healing. Contamination means that bacteria are present in the wound. Colonization is the replication of bacteria which adhere to the wound surface, but which will cause no host response. Low levels of colonization do not impair wound healing. The point at which bacteria multiply on the wound surface and interfere with wound healing without creating a host response. Additionally, localized infection is not dependent upon a specific bacterial quantity. Previously I suggested the 10 to the power of 5 colony-forming units. Spreading infections indicates that the bacteria have moved onto the peri-wound soft tissue, which will result in erythema and possible pain and edema. Systemic infection occurs when bacteria enter the bloodstream. Whilst vigilance is important for any chronic wound, treatment is required for wounds with local, spreading or systemic infection. Coming up, we will discuss assessment and management of each of these findings. When assessing for infection, first ask yourself, is the wound actually progressing? If so, the wound is probably contaminated or has a low level colonization of bacteria. Treatment in this case would include cleansing the wound and applying appropriate dressing. and monitoring for signs and symptoms of an infection. To check your knowledge and understanding, try and answer these 3 quiz questions. Well done. You've now completed this bite-sized module. Take the time to reflect on how you will take some of what you've learnt and apply it to your daily practice. Please click on the link to go to the full 15-minute version of this presentation. Once this is completed, you will have the opportunity to download NMC revalidation forms. Thank you very much for your time today. Please remember to look at the other sections to access additional modules to help you on your learning journey.